Hi, I'm Dr. DeFabio, and it's a great day to talk ankle and foot injuries. We're going to continue our discussion about the ankle and foot with inversion ankle sprains, rolling your ankle, and what you can do to get back in the game in 2 weeks. That's right, 2 weeks. Hey, Mike, say hi to everybody.
Hey.
So we're going to talk about when you roll your foot this way. Mike, how often do we see sprained ankles in the office?
Almost every day.
Exactly. Now, sometimes people come in, right away? And other times they come in after they've been in a boot or a walking cast for a week to sometimes a month. And what difference do you see in the rehab of the people who've been in the boot versus the people that come in right away?
The boot prolongs the effect a lot longer. It takes way longer to get them moving again.
Okay, all right, you got that? So what happens is when you immobilize an area, the muscles that work on that area lose their strength at 20% a week. Not only do they atrophy that quickly, what also happens is the joint gets stuck in that position and it gets stiff. And then sometimes we do want muscle lengthening, sometimes we do want muscle contracting, so there could be a reason to immobilize. But when it comes to an ankle sprain, you really want to get motion back as quick as possible and restore function of the ankle as quick as possible. Now, most ankle sprains are inversion sprains, and they're going to involve one of three ligaments. We mark this one ligament right in through here that runs from the ankle forward, your anterior talofibular ligament. Then you have back behind it, the posterior talofibular ligament, runs from the outside bone of your leg to the bone that in between your two ankle bones, your talus. And that's very important. Motion of the talus between your two ankle bones is what allows your foot to flex up and down. So if you're losing that flexion up and down, that could be there's a joint restriction in the what's called mortise joint, okay? Very, very important. We're going to talk about that in a second. The third ankle ligament that's really affected is the one down and through here. Your fibula is the bone to your calcaneus, the heel bone. So those are the three that will get impacted when you roll the foot. If the foot is pointed down and you roll it, it generally is going to get this anterior talofibular ligament. A high ankle sprain we're not going to talk about today. There's a ligament that runs between your fibula and your tibia, both of the shin bones in through here, and that gets sprained up in here. And that's a high ankle sprain, completely different animal. If you've had an ankle sprain, it's been acute, get it x-rayed. We got to know if something's been fractured or broken because that will impact what we're going to do. Once we know it's not x-ray, there's one of three types of sprains it's going to be. A grade 1, which means up to 25% of these fibers have been injured, a mild. A grade 2, 25 to 50% of these fibers have been injured. Or a grade 3, over 50% have been injured. Standard care in the medical community is to immobilize it, put it in a boot, don't use it, let it heal. Okay, we want it to heal, but we know in the sports and chiropractic and manual therapy world, we want to stimulate those torn ligaments to lay down new and stronger tissue. And that's, you've seen us do it before. We'll use our instruments to get in there and stimulate it. Research has shown when you stimulate a ligament or a tendon that's been injured mechanically, it will help lay down better, higher quality tissue in the right direction so you get compliance. That's number one. Number two, we want to make sure that talus is moving properly. A lot of times when you sprain the ankle, the talus gets shifted and locked, and you lose that able to dorsiflex. That's why you have to walk flat-footed when you sprain your ankle, all right? It happened to me. I was skiing, snowboarding, wiped out, couldn't walk, went and had an x-ray. The doc said, there's nothing wrong with it. I said, but doc, you know, he gave me a boot. But I said, if it's not fractured, what do you give me a boot for? I went, got an adjustment of my ankle, in on crutches, walked out. because the problem was the talus had rotated. Thank God I knew what I needed. So we need to get an adjustment of the talus when it's locked up. Is it always locked up? Not always, but when it is, you got to get it adjusted. Some soft tissue work. Then you do need to protect these ligaments from injury. So sport-specific taping will do that. We'll use the heavy leukotape over the area to stabilize it so that you can maintain this motion, which is what we want. That's where those stirrup casts come in. They do allow you to go up and down. It's not a complete immobilizer, but it prevents this motion. With taping specifically, we can do the same thing and allow even greater movement because motion is life. What are the exercises you start on for an acute ankle sprain? Simple point and flex. When you point, toes go down and curl. When you flex, they come up and curl. Simple circles clockwise. Simple circles counterclockwise. For an acute ankle sprain, that's where you start to fatigue at least once a day, all right? Make sure that ankle gets adjusted when it needs to be adjusted, so have it checked, and keep it taped with those chiropractic sport-specific taping procedures. So that's how you manage the acute ankle. Once it starts feeling better, you got to go to strengthening. So we're going to segue this video into our next video, which is on our top 3 exercises for ankle rehab. It'll strengthen the front, the back, the outside, and the inside. So that's phase 2. And then we'll go over what happens when you sprain your ankle to the whole kinetic chain on the last video of this series. So it's been a great day to talk rehab. We talked about the ligaments that can get involved, get some mechanical stimulation, some Graston, some factor over it, get the ankle adjusted if it needs to be important, and then start working that range of motion as soon as possible. We're going to have you back in 2 weeks, unless it's a advanced grade 3 or there's a fracture. That's how it works. I'm Dr. DeFabio. Thanks for tuning in, and please like and share and keep those joints moving. Have a great day.